Torn meniscus causes and treatment. The medial meniscus is a band of cartilage that functions to limit contact between bones, act as a shock absorber, reduce bone friction to allow for smooth movement, and more evenly distribute weight during movement. The medial meniscus is a common site of knee injury, with tears being the most frequent injury. Medial meniscus tears in younger adults are commonly a result of a twisting knee injury or a trauma. However, trauma does not have to be involved. A simple rapid twist or repetitive squatting motion can tear the meniscus. Obesity may also be a contributing factor in both cases. An injury to a supporting ligament in the knee can also increase the probability of injury, as ligament injuries make the knee more unstable and prone to injury. In older adults, the cause of tearing is often due to degenerative changes that cause the menisci to become jagged or frayed. Symptoms include pain and swelling across the joint line that's often worse if the knee is bent or twisted, knee catching, locking, or giving away. If the torn fragment lodges in the knee may remain locked and unable to bend, inability to place any weight on the affected knee, and joint tenderness. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the sinew herbal ice on your knee to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the knee. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your knee with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your knee with chronic sinew liniments to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your knee to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your knee with the sinew warming soak to bring warmth into the knee to drive coldness out of damaged tissues, increase local circulation, ease joint pain, and increase range of motion. The sinew warming soak is particularly useful if your knee is more painful and sensitive to cold or hurts more in cold weather. The soak can be used by saturating a towel in the liquid and applying it to your knee. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.